I was looking through NHS jobs, I came across ODP. I was surprised that I hadn't heard of it before. So the more I looked into it, the more I wanted to do it. It's a critical care environment, you're caring for people on an individual basis.
I love being in the NHS. I like the vibe that you get in theatre. It's not an easy job, it's a hard job, but it's very rewarding.
Human bodies and how they work and seeing operations happen right in front of you and being a part of it.
Anybody that's undergone any sort of surgical treatment or any experience through theatres will have encountered an ODP, whether they're aware of it or not. The main role of an operating department practitioner is to care for patients throughout their surgical journey. There's 3 specialities: anaesthetics, scrub and recovery. So that involves assisting either an anaesthetist in an anaesthetic for a patient, the surgical assistant of a surgeon or registrar in carrying out the operation, and then working as a lone practitioner in the recovery role, recovering a patient who has gone through an anaesthetic.
You're working in a theatre with lots of different staff. There's surgeons, anaesthetists, there's nurses, there's us. And it's really good because you get to see so many different operations. You can see a C-section one day and then a hip replacement the next, and everything's just so interesting.
I like the fact that your skills are so transferable, so if you're a ward nurse or anything like that, you're stuck in one position and you tend to be in one sort of field, whereas as an ODP you can be in a number of different surgical fields.
There are a lot of career options in operating department practice. Surgical first assistant, you can do anaesthetic further courses, you can also do mentoring, move into education as I'm doing. There's a really wide variety of roles and they're becoming more and more open to ODPs.
I'm an operating department practitioner who's now moved into the field of surgical first assistant. With the doctors' numbers reducing within the theatre environment, then my role, or the surgical assistant's role, is actually increasing within the theatre environment.
The opportunity, if you want to develop, is there. My role developed and I became interested in research. I then moved on to do a secondment with Huddersfield University as a lecturer practitioner. Then as I got to sort of my 3rd year and as I completed my masters, I progressed into my new research role, which was a unique role to the trust.
I've been an operating department practitioner for about 12 years and then I moved roles into the education role, and the primary function of that is to plan, manage and facilitate trust-wide clinical placements. There are lots of opportunities for development.
When we was designing the 3-year degree here, we wanted to incorporate some different approach to education and placements.
Placement opportunities within the University of Huddersfield are really varied, and it meant that I got to experience small hospitals, large hospitals and a vast variety of different specialities.
The ability to move from team to team and from speciality to speciality provided a good grounding for when I qualified, because I'd had that experience in so many different hospitals, in different trusts.
Learnt lots of new skills all in a very short space of time, but I'm getting to practice them every day. I actually feel like I'm coming into a job most days as opposed to being a student, so although I'm learning, it's, you know, you feel like part of the team. So.
60% of the course is placement based. They give you the theory behind before they send you out on placement, but then I think you do actually learn best while on placement.
You can learn all the stuff from a textbook, but you're still also picking up new tricks, learning new things every single day from other people, because you've got just a wide range of experience, both from the lecturers and from the mentors.
It's good. You come away feeling like you've really made a difference to yourself.
Employment rates for ODP are really high. Our students who don't qualify for another 6 months, probably about 50% of them have already got job offers in place because there's such a great demand for our students once they qualify.
I have to say I love it. I mean, it's the best job role that I've moved into.
Meeting these patients and knowing that I can do something for them is a stimulating environment.
You're helping people and that's the main aspect of your job. Love it.
I've had a brilliant time over the 3 years, so I'm nearly 40 and it's the best thing I've ever done.
The University of Huddersfield, inspiring tomorrow's professionals.